So thank you everyone for taking part. It's really important, that you do take part as you all did and had a go and practice, because it's very easy to just tell you what to do and say, well done, bye-bye, but really we don't remember. So actually taking part and everyone had a go was really good to see. The last part we're going to talk about is the AED. So you all did the demonstration for CPR. You all did that. You did the assessment. They weren't responding, they weren't breathing, and you started chest compressions. You started pressing on the chest. But you should have, and you will have asked the person, please call 999. Please go to try to find an AED. You're doing your chest compressions. So do you want to do chest compressions? So you're doing your chest compressions. You're doing the chest compressions, and then actually I've arrived with the AED. So this is now going to explain what do you now do at this point. I'm sorry. So this is the add-on. To earlier, you're doing the chest compressions, the machines arrived. What do you now do? So we're going to show a video as well. So this is the machine, they look different. The beauty here is this yellow box outside is this AED. So there's one of these outside. It's locked in a cabinet. If you phone 999, they will tell you the code to the nearest one. If you're at the top of Darnell, they'll tell you the code outside Greenland, the school, outside the GP. There's one of these as well. So wherever you are, they know where the closest one is, and they tell you the code for the closest one. So if you're obviously on Swartcliffe Road or somewhere around here, they'll tell you the code for this one. And this is the machine that you get out. So I'm going to show the video, and then we'll talk you through what to do.
When you have your defibrillator, inside there will be the defibrillator itself and some pads in a foil packet. When you open the foil packet, there will be a lead for 2 pads which will demonstrate where they should be placed on the chest. Firstly, turn the defibrillator on.
Apply pads to patient's bare chest.
Then place the pads in these positions, here and here.
Plug in pad connector next to flashing light.
Then connect the pads to the defibrillator.
Analyzing heart rhythm. Do not touch the patient.
Then you need to follow the instructions of the defibrillator as it analyzes the rhythm and will tell you whether a shock is advised or not.
Shock advised. Charging.
If a shock is advised, wait until the defibrillator has finished charging.
Stay clear of patient. Deliver shock now.
And then press the flashing button.
Shock delivered. If needed, begin CPR.
After you've delivered the shock, you'll need to continue CPR. Then the defibrillator will time for 2 minutes, at which point it will ask you to stop doing CPR and it will reassess the rhythm.
So this is automated. So it does the thinking for you, it does the work for you, it talks and gives you the explanation. Can you remember right at the very start, I mentioned something called cardiac arrest. So that's where the heart isn't pumping because of an electrical problem, i.e. the electrical signal of the heart is not working properly. And this is why, when you're doing the chest compressions, you're pumping the heart, you're allowing for blood to go around, but the solution, the fix, is that an electrical shock needs to go to the heart to restart it. We're familiar with the fact, when a car's broken down, you jump start the car to get it going. This is kind of the same principle for the heart, but the machine knows when it's the right situation and when it's not the wrong situation. So you're doing CPR, you've got the machine, and I'm going to show you what you should be doing. This pads need to attach to the skin. So whatever clothing is on needs to come off, because the pad needs to attach to the skin, to the body of the person for it to work. When you do get the machine and you turn it on, it will start talking to you.
Unit okay.
So during this time, you should ideally be doing CPR.
Change the battery.
Working.
Plug in the pad's cable.
So when you've got the pads, you want to connect the
Stay
pad.
calm. Check responsiveness.
So this is what you
Call
already
for
know.
help.
You do this. You've done
Open
this
the
already.
airway.
Check breathing.
This is all that we
Adult
talked about.
pads.
You can see how it's telling you
Remove
everything
the
you
pad
learnt.
package.
The pads, this one is connected. In some, the ones sometimes it's separate. two
Cut
separate
or
ones.
tear clothing to expose the patient's bare chest. Cut or tear clothing to expose the patient's bare chest.
And essentially, you will be attaching the pads. So one,
Open pad package.
there are pictures on there to show where it goes. So it's always, one is on the kind of right shoulder area, and the other is on
Attach
the left.
pads to the patient's bare chest.
And this is what it does. During this time, you're doing CPR. The machine will then tell you, stop
Change the
CPR.
battery.
It will tell you,
Attach
stop
pads to the
CPR.
patient's bare chest. Unit powering off.
The machine will tell you, stop CPR, analyzing rhythm. So you may have heard of the term ECG. It analyzes the rhythm of the heart, and it will tell you to do two things. One will be, we need to give a shock. So it will say, stand away, because it will give an electrical shock. So it's going to say, stand away, shock delivered, shock to be delivered, and you press the orange button. Or it's going to say, not suitable for shock, and carry on with the CPR. In these scenarios, the importance is, do chest compressions. If you have a machine, just listen to the machine. It will tell you what to do. And if it wants to deliver a shock, it will say, stand back, don't touch the body, press the orange button. If it doesn't want you to do that, it will just say, carry on CPR, and you just carry on. Any questions on this part so
Yeah,
far?
question, Zach.
Yeah.
Why are you connecting this machine? I still don't understand.
So, the cardiac arrest, so the heart has a very fine electrical pulse in the heart to cause it to contract.
Right.
If that electrical rhythm or pulse is disorganized or not correct, then the heart's doing this and not pumping. So this electrical shock will restart the heart and then allow it to pump correctly. You don't need to know when that is or that isn't. That's what the machine does. It analyzes and it decides, is this the right time to give a shock? If it is, it will tell you. If it is not, because there's certain instances it's not suitable, it will say just carry on with chest compressions. The ambulance will come. They're going to have other medications. They're going to have other things as well
What
available.
if the patient already gone?
In what sense?
They're dead.
They're dead anyway because their
Oh,
heart
okay.
stopped. So what you're doing is continuing to see if there is anything that's
Right.
going to help. If you're able to do chest compression, if you're able to attach the defibrillator, the ambulance comes, they give the medication, they give everything. There's no guarantee. 10% chance really that this person will become alive.
Right.
But the point is that you don't know who that 10% is. You do this. If nothing works, this is qadar, this is written, that's it.
Of course.
It's in our ability that if we can do something, we should try. Who knows? If your intention is to help, even if that person's passed away, if your intention is there, you may be still rewarded as if you have saved that person's life. The point is, you just have to try. It's the same with medication, everything. You should try your best. Everything else is left with Allah. And that's what you're doing here. The foolish thing to do is, you see the person is unconscious, we all sit around and just wait for the ambulance to come, when one of us could have been doing something. That's the difference. Both situations may result in the same outcome, but one is we've tried and we've done everything. The other is we just sat and waited. Hopefully now everyone, whatever scenarios you go into, you can be that person to be like, get the AED, we'll listen to the instructions, we'll start CPR and see where we go. Okay? Any final questions from anyone?
How many times you need to give a shock?
So the machine will decide whether it gives a shock or not, and it will carry on as many times as it. So if the rhythm of the heart is correct, it will say it needs to deliver a shock. There's a pause every 2 minutes. So it delivers a shock, carry on chest compressions 2 minutes, analyzes. That rhythm will continue going.
So follow the voice of the machine.
Follow the voice of the machine, yeah. The first is you use your own voice, you start CPR. Once the machine is there, then that instructs you. Any other questions?
How does this machine work?
In terms of?
Generally, just
It's got a program written in, so it analyzes the heart rhythm and then it
Right.
follows the program to know what to do.
Does it carry battery itself?
So there's a battery in here that enough to deliver a few shocks. So once the machine outside has been used, if it's ever used, it would need a brand new battery for it to be live and available for the next time round, because it discharges that power from the battery.
How much are they machine cost?
I think it's probably 1,000 or plus with it. It's very small, but it has to be precise in what it does. Fine. Brilliant. I think, is that everything?
That's it.
Do you want to take a picture outside with the
Please, yeah.
yeah.
So we can, yeah, it's like a group picture here
Yeah.
and outside as well.
Okay,
Please.
brilliant.
You want the lights on to take a
Yeah.
picture?
So if you've written your name down and things like this, if anyone is able to, actually, if they can fill in that form, that would be really good.
Yeah.
This just gives us feedback on this session,
Okay.
how we could, if there's anything different we
Where-
can do
where
and
they
things like
fall?
that.